Hello, good afternoon, everyone. I am Dr. Deepa Reddy. I am a practicing physician and diabetologist in Ambernath, Ulhasnagar area. So today the topic of my discussion is pedal edema as an indicator of chronic kidney disease. So in today's session, we will discuss pedal edema as an indicator of chronic kidney disease. Let's explore what pedal edema is, its causes, and how it can signify the presence of chronic kidney disease. Pedal edema, of course, as we everybody know, that it is the swelling of the feet and ankles due to fluid buildup in the tissues. It's an important sign in many medical conditions like chronic kidney disease and often one of the first signs of a health problem. Fluid leaks from the small blood vessels into the surrounding leg tissue, causing swelling. So normally this fluid stays inside the vessels, but sometimes things go wrong. When the tiny vessels become weak and fragile, like a leaky pipe, this allows fluid to escape into the surrounding tissue. The pressure inside the vessels increases, forcing even more fluid out of the tissue. So it's like water gushing out of a burst pipe. The balance of proteins in your blood is disrupted, affecting the flow of the fluid. This makes it harder for the fluid to stay inside the vessels. Your body's drainage system, the lymphatic system, isn't working properly. So this means excess fluid can't be removed and swelling builds up into the legs or the lower extremities due to gravity, leading to swelling. So these factors together cause a noticeable swelling, which is also known as pedal edema. Pedal edema can be caused by conditions such as chronic kidney disease. It could be due to heart failure. It could be due to liver disease. And certain medications also give this condition. So we are here to discuss pedal edema and chronic kidney disease. In chronic kidney disease, the kidneys are unable to filter effectively the waste and excess fluid from the body, from the blood. So as kidney function declines, the fluid accumulates in the body, causing swelling in the legs and lower extremities. This swelling is often an early sign of chronic kidney disease. Chronic kidney disease is diagnosed when the kidneys are damaged, not working properly, or not working at all, and this lasts for at least 3 months. The condition means that the kidneys are gradually losing their ability to function properly. In chronic kidney disease, swelling can happen for few reasons. The kidneys might not be able to get rid of the extra salt and water, causing fluid to build up. Also, the kidneys might lose important proteins through urine, which normally help to keep the fluid in the blood vessels. This extra fluid can make problems like high blood pressure and heart failure worse. So as chronic kidney disease gets worse, swelling in the legs, feet, ankles increases and it becomes more noticeable, like pedal edema. So this happens because the kidneys aren't able to get rid of the extra fluid and salt in the body. So doctors use swelling in both the legs, that is bilateral pedal edema, to help check kidney function, which is different from the swelling in just one leg, which could mean other problems. So to diagnose pedal edema and chronic kidney disease, doctors start with a detailed medical history and physical examination to understand what might be causing the swelling. They check for signs like whether the swelling leaves a dent when pressed, like they hold their finger inside your edema thing, and if it is making a dent, then that means it is a pitting edema. Like when the swelling leaves a dent, when it is pressed or it is tender or skin changes is there, so that's a pitting edema, which is commonly seen in the kidney disease. And doctors use lab tests also to understand the kidney health better. They start with blood tests to check the level of substances like serum creatinine. High levels of serum creatinine can indicate that the kidneys aren't working properly. They also perform urine tests to look for protein. So they check whether there is a protein leak in the urine, which normally should be very low. But then when there is too much protein, it often means that the kidneys are damaged. These tests help doctors see how well the kidneys are filtering waste and managing fluids. In addition to the basic tests, doctor might order extra tests to get more information. They might check how well the thyroid gland is working. They look for the heart-related proteins that can affect the swelling and measure liver enzymes to see if the liver is involved. These additional tests help identify if there are other reasons for swelling, and they help doctors to decide on what best treatment is suitable for the patient. So for further diagnosis, doctors use imaging techniques to get a better look at the kidneys, and ultrasound can show if patient is suffering from chronic kidney disease. The kidney smile on the ultrasound is usually smaller than the usual. And if the kidney's outer layer is thinning, or if there are any cysts, like a polycystic kidney disease is also a disease which can cause kidney failure. Then a low dose CT scan without contrast can also help to find out whether kidney is affected due to renal stones or blockages in the urinary tubes. So renal scans also give detailed information about the kidney structure and function, which is especially useful for children. Taking a detailed medical history and doing a thorough physical examination along with specific lab tests are essential for figuring out what's causing swelling in people with chronic kidney disease. This careful approach helps catch kidney problems early and allows doctor to start treatments that manage fluid buildup, slow down the disease, and improve overall health. Next, move to the management of pedal edema, which mainly involves using medications called diuretics to help remove the extra fluid in the body. Along with these medications, making lifestyle changes and having regular follow-up checkups with your doctor are very, very important. These checkups help monitor kidney function and make any necessary changes to your treatment plan. Keeping a close eye on your health and lab results helps detect any changes in the kidney function early so that the doctors can adjust your treatment to better manage fluid balance and overall health. Lastly, maintaining a healthy lifestyle with regular exercise, a balanced diet which is very low in the salt and potassium intake, and routine medical checkups are very, very essential in managing chronic kidney disease and reducing complications like pedal edema. Thank you.